There's a nationwide target to have shared care records in place by later this year, and this ties into a long-standing narrative of better integrating social care and healthcare. I'm Sean Ridley, Clinical Lead for Cerner's Shared Care Records, and I'm joined today by Caroline Saxby, an Independence and Wellbeing Practitioner, and Gillian Allen, an Allocations Coordinator for Adult Community Services, who have recently begun using the Health Information Exchange, HIE for short, as part of their roles for Suffolk County Council. Caroline, firstly to you, please can you tell us what it means to be an Independence and Wellbeing Practitioner?
My role is quite, it's varied, certainly interesting. I undertake assessments and reviews, vulnerable people and their carers. Some cases are quite complex. I'm looking at just not a person's needs, but also their strengths, their communities, the support that's around them, and look to aim to get solutions really to their problems and needs.
And what difference does that make to a person? So put another way, without it, what is the trajectory of that person's next days, weeks, months?
I can recall a case, and you have to understand at the moment I'm doing continuing healthcare, so I'm working with health, where based on the evidence that we had provided at the time, it was doubtful that that person would be found eligible for continuing healthcare funding. Because I had access to HIE in real time, I was able to update the multidisciplinary team of recent events and clinical activity, which then demonstrated an intensity and complexity of the need, and therefore we were able to make a recommendation of eligibility for continuing healthcare funding for that person.
Thanks for exploring that with me. And then overall a bit more, with the HIE being in place for a few months now, what have you noticed has been the effect on relationships in general between the care services and the health services, if any different?
Well, it's definitely brought us together. Alongside with the pandemic, we've had to look to work more collaboratively anyway. The HIE has been particularly helpful because I can complement the information already gathered, but it's also in real time, so it saves us a lot of time and sort of stress really, being able to know that we can provide an up-to-date, accurate assessments of somebody's clinical need.
And now, Gillian, to yourself, I've noticed you've been nodding along throughout the last few minutes. Clearly all this resonates with you. So as of last month, which is April 2021, you were one of 250 Suffolk Council care professionals using the HIE. And amongst you all, there's about 3,000 views of a person's HIE record per month. How do those numbers make you feel, and what do they translate into?
I think it shows there's obviously been a lot of users, and there's a high number of views demonstrate that people are using it, and the time, I think there'll have been time saved whilst you're looking up on the system. You're not waiting to speak to a health professional trying to get information regarding a customer. I think use of HIE helps when making decisions, particularly in my role. You have to prioritise how urgent a customer's case is, and by having access to HIE, you can get a better understanding of what's going on in the background with them, what's happening with their health slightly more, how often they've been in and out of hospital, and also helps being able to see if they've had any referrals onto any other services, which is particularly helpful. Also, during COVID, it's helped to be able to see if the person's had their COVID test and the COVID test results when waiting to send them out to care homes.
And we saw a quantitative analysis of the in-house reablement service known as Home, and that demonstrated substantial time efficiency savings. Can you tell us about that service and what difference has been felt because of the HIE?
The HIE has allowed rather than the Home First team leaders previously to HIE would need to ring the hospital, ring the wards, and get information verbally across the phone from the medical health professionals about somebody's care needs, etc. Well, now they're able to go onto the system and they can see for themselves the discharge letter. They can also see any medication changes, if the person's changed their medication. And I think it also gives them a clearer picture, a far more clearer picture of the person. Whereas previously you would have a little bit of disjointed view. And they can also see whether they've had several hospital admissions quite recently, and particularly in cases where somebody may have dementia or slightly confused, then they're able to look on HIE and they know that information is up to date and it's accurate and correct.
Considering now it probably feels like more of the norm, it's no longer that novel. Sum up, what that is doing for you and then your team, what that is enabling, how it makes you feel, and what you hope to see next.
What I've found is that initially, I think to begin with, we've used the system more and more. Initially, we would just use it once or twice to look something up, but I found the more I've used the system, the more helpful I've found it. And it's sort of something that comes to mind straight away now. And I know within the team meetings we've had discussions around how helpful it's been. And, sometimes people have said, what about, where can I find this? And someone has said, look on the HIE, it's here, you'll find it on there. And I think it's only something that's going to get better and better as we progress, more people use it. It's a very easy system to click on the link and go straight through. You haven't got to come out of our Liquid Logic system and then log into another system. It's been very helpful having it within our system and you click on the button that way, rather than sometimes if you were in one system, you wouldn't want to have to log out of that system and then log into another system to look it up and find out what's happening with the customer.
Thanks, Gillian. Thank you to Caroline. It's been brilliant to hear from you both today. It's been a privilege and it's been very inspirational. To conclude, it's also exciting to hear that there's still room for improvement and that the data sets available for users of shared care records can be expanded, particularly the care home element there. And looking ahead, it's likely that the next logical step will be for care services to begin sharing care data into the shared care record for health professionals to make equally good use of.